So good day, everyone. In the next 15 minutes, I'd like to invite you to a journey of how a cross-organization coalition was established and how we carry out the work to advance school youth mental health. So I will share with you three main things. One is the milestones of how the work was carried out. Then what was the main problem we identify and how we address it. Like Ali shared, it's actually a problem that was identified by our community partners, and they came to UWT to seek for collaborations. And then last thing is things that we learn in this journey, and the next steps with the hope that we can have more people who are interested in supporting youth mental health and who have the expertise to support our coalition. So the story started from May 2021. At that time, one of the biggest issue at that time was COVID. So why we focus on school and why mental health? First of all, schools provide numerous benefits beyond education, including, if you can imagine, school meal programs, social, physical, behavioral, and mental health services. And when COVID hit and schools have to close, it really caused a lot of impacts, especially according to a lot of reports and research among students with low incomes and among students in K-12 schools. So just to name a few, our government issued an emergency proclamation that indicated that there was a children and youth mental health crisis. And based on CDC report, hospitals, emergency departments sees a surge on suicide attempts among students. So this concerning and urgent situation make us work together with public OSPI, Tacoma Public Schools, and Multicare. Started with in June and August 2021, we got together. We had several meetings to determine what would be the most important target that we need to address. And we also discussed possible school and project champions that we can collaborate. We also find funding opportunity to support the work. So in October 2021, we first got a grant from Multicare Behavioral Health Foundation to establish this coalition. And Dr. McIntyre, who is and Susan Remus, who is actually our graduate, our master graduate from our School of Nursing and Healthcare Leadership. They are the co-founders of this coalition, and they are affiliated with Multicare. And they reach out to me to work with them on, I will tell you more about what we are doing. And also our multiple stakeholders in the Tacoma Public Schools, like Laura Allen and Brady Baker. So this is a picture that I wanna share with you. We gave a talk last Friday, on January 13. We teach students in Stadium High School about the problems of substance abuse and teach them how to identify different substances and how to cope with substance use. And this is one of the students who from UWT. His name is Clayton Hamilton, and he's in School of Education. So we involve multiple students from different disciplines and across both undergrad and graduate programs in our coalition work. And what's exciting for Clayton is that his ultimate career goal is become a high school science teacher. So through the support of this work, he can advance his career goals. And after we had the meetings and determined the needs and demands, we, Michelle inspired me and encouraged me to pursue this grant, and that's supported by Office of Community Partnerships. And I'm very grateful because Michelle is a wonderful mentor, and she told me a lot. And Julia and Carly, I really couldn't start the work without your help, because I had no idea about what MOU stands for and how to establish the contracts with our community partners. So I'm so grateful for your support and guidance and all the nitty-gritty things that you helped me with during the process. And so we got a funding in January 2022, and I'll share with you what are the specific projects that we conducted. And I leave some, placeholder here because I know Lisa is here too, and she's aware of things that I have been doing in terms of research. So I will share with you about what these placeholders are as next steps of our coalition. Okay, so demands, like I said, our community, Tacoma Public Schools and Multi-Care reach out to UWT because of the problems of the mental health crisis caused by COVID-19 and the surge of emergency visits for suicidal ideation and suicidal behaviors. So after the steering committee meetings in May and June, we identified gaps with Tacoma Public Schools that there are a lot of things that we need to address, including behavioral health monitoring, identification, and intervention services for children who suffer from mental health struggles due to COVID-19. And we already know that mental health issues affect 20 to 25 of children and adolescents in the United States. And of these, only 36% of them receive mental health services. So there's really an inequity problem here. And that's, in the whole, in the United States. But for Washington State, we actually ranked 43 out of 51 in the US for equitable access to mental health care for youth. And for Tacoma Public Schools, it has a lot of underrepresented populations, and their student population is very diverse, and 46% of students are economically disadvantaged. So they have less access to mental health services. And then for Multi-Care, this project really aligns with their mission to improve the health of patients and the whole community. And for UWT, our community engagement mission is to train our students into human service professionals and socially responsible leaders with the opportunity to know about their community, like Tacoma Public Schools, Multi-Care, how the behavioral health is provided, and possibly obtain employment opportunities. Like I said, one of our grad students involved in this project, he will pursue his career in Tacoma Public Schools. And we already identified the problem of mental health crisis, and we identify Tacoma Public Schools has limited access to mental health services for students. Therefore, by using the collaborative intervention planning framework and community-based participatory research, we identify one of the solutions is to provide a case consultation for school counselors. So basically, Multi-Care, the psychiatrist, Dr. McIntyre, he provided monthly behavioral health consultation with counselors in the Tacoma Public Schools. And then we discuss any students' behavioral health issues, and we discuss what might be the potential resources they can provide. And then based on research, this kind of expert-led case consultation is efficient, cost-effective, and scalable. And then in addition to determine an efficient intervention to address the inequity of mental health access, we also established the workflow. We have monthly steering committee meetings with our stakeholders, and we hire and involve students. And for my role, it's mainly to do the program evaluation because I'm really interested in seeing the impact of this kind of community engagement work through conducting mixed methods research. And we have had 10 monthly case consultation sessions, and we evaluated the mid-quarter outcomes in summer 2022. And based on the interviews, these are the 3 main themes that we got. First of all, the case consultation session was conducted online through Zoom, through Microsoft Teams. That's what the platform our stakeholders prefer. It's a safe and supportive environment. I'll let you take a moment to read the quotes. And then school counselors really think that this case consultation really provides additional access for them to know what to do with the students and what the multi-tier approach school counselors can do. For example, when they see someone who is struggling, what's the first thing they can do through interviewing and through initial intervention? And if things do not get better, what will be the next referral they can do to refer students to mental health services? And how do they work with family caregivers? And then we got the feedback that all of the counselors think that this kind of case consultation approach is valuable and helpful for them, and also for the students. Okay, so lessons learned. After we got the funding, I actually think, I started to realize how much more support we might need. So that's why I consulted Office of Research and have Lisa's support and my the support from my School of Nursing and Healthcare Leadership. I pursue and received the funding from Population Health in January. In May, and then we got the funding. This was funded by Elevate Health. And then we also got the funding from Multi-Care Behavioral Health Foundation to continue our work. And in January 23rd, which is like this month, I got the funding from Gavi Institute for Brain Health Solutions to work with Smart Center in UW Seattle to address, whether the things that we are doing can actually match the needs from different race and ethnicity groups of students. And next step, we also collected a lot of survey responses from the case consultation session. Like I said, we already conducted 9 sessions, and in total, we will have 13 sessions in the end of this year. The blue lines here are the changes after the case consultation. So as you can see, there are a lot of fluctuated, points, and we haven't had a chance to, merge all of the data together to see, longitudinal changes, and also to determine the dose response effects of like how many sessions each person attend will related to the differences of their responses to the survey. And the survey is evaluating school counselors' self-efficacy, which is their confidence of dealing with students' mental health struggles. So this will be my next step, is to look at the data across the board and across different time points. So I welcome to folks who might have statistic expertise and folks who might be interested in this topic, who can generate new research questions, and I'm happy to provide the data and share the data and discuss further. And if you have students who might be interested in using this data as their scholarly inquiry projects, please don't hesitate to reach out to me. So again, I'm very, very grateful for Faculty Fellowship's support. It's really a starting point to broaden my horizon of how community engagement work can be so fruitful, and while there are a lot of challenges that we need to address, day by day, and which are also motivating me to get to seek for more funding support and more collaborations. So thank you everyone for your attention, and I look forward to discussing with you further and listening to other community engagement projects. Thank you.